And now we start with GIT. At first we see the pleomorphic salivary adenoma or the pleomorphic adenoma. It is a benign tumor of salivary gland, mainly the parotid gland. About 60% tumor of parotid gland. It is the in the superficial lobe of parotid gland. So here we can see these are the normal tissue of the gland. These are the normal tissue of the gland. Okay, and it is the capsule. It is the capsule, and here you can see some bluish area. It is the bluish area. It is mainly the chondromyxoid matrix. Okay, and here you can see it is also both two are the same structure. So here you can see a duct-like structure. Okay, here you can see a duct-like structure here, and it is surrounded by the myoepithelial cell. We cannot see here properly because it is 10x or 40x zooming, so you cannot see properly, but here you can see the duct. And myoepithelial cells are surrounding the ducts. Okay, the ducts are formed by the tumor cell, and here you can see the bluish area. It is the chondromyxoid matrix. So what is the points of the pleomorphic salivary adenoma you have to write in the exam? First, it is pleomorphic appearance is seen here. Tumor cells are forming tubules. Here we see the tumor cells are forming tubules surrounded by the myoepithelial cell. We cannot see here properly, but you have to write. And here is the beside this, it is a mesenchymal like background of loose myxoid tissue. Islets of hyaline, means that is the hyaline cartilage we read in the first year. So islands of hyaline, chondroid and myxoid matrix. Okay, so it is the pleomorphic salivary adenoma. Next we goes to the colon cancer. In the colon cancer, you can see it is the normal structure of glands, the normal lining. Okay, here you can see that the glands are properly arranged in a very regular manner, but here you can see the glands are ruptured or haphazardly arranged, and the epithelial layers are disrupt, and it is a very haphazard structure. So what is the point? Loss of normal architecture of the glands. You can see here, and it is the 100x zooming of this portion. You can see, you cannot identify the glands and the others. It is the gland. Okay, it is the gland. So glands normal architecture is lost, and you know that when the cancer when a cell become cancer cell, the nuclear cytoplasmic ratio gone high, and pleomorphism and hyperchromasia is seen here. Next we goes to intestinal TB. So in the intestinal TB, it's the granuloma formation. We can see the caseous necrosis also. So main is the giant cell. Okay, it is the giant cell. You can see it is the Langhans giant cell. A typical Langhans giant cell is like U-shaped arranged nucleus, and here you can see this, or the horseshoe shape arranged nucleus. So it is the Langhans giant cell. It's also a giant cell. Here also a giant cell. So these are the giant cells. And besides the giant cell, here it is these are the epithelioid cell. It is the probably the caseous necrosis, probably, because the caseous necrosed area is surrounded by the epithelial cell and the giant cell. Okay, mainly the epithelial cell, but the epithelial cell fuse together and form the giant cells. So what is the points? The typical giant cell is seen and epithelioid cell are seen, and you can see the you can write the caseous necrosis is seen also, you can write it. Then we goes to the acute appendicitis. So in the appendix you can see the glands. Here you can see the glands, but in the acute appendicitis it is appendicitis is the inflammation of the appendix. So you can see the ulceration of mucus or erosion of mucus. The mucosal erosion you can see here. It is the erosions. Okay, it is the mucosal layer because here is the glands present, and here you can see it is the muscular layer. So muscular layer you can see the deep blue dots. The deep blue dots, these are the neutrophil infiltration. Okay, these are the neutrophilic infiltration. Here you can all over the, you can see all over here all over the muscular layer. So muscularis propria shows infiltration by neutrophils. It is the diagnostic property for the acute appendicitis. Okay, and you can see the lymphoid follicle. What is the lymphoid follicle? These are the lymphoid follicle. Okay, these are the lymphoid follicle. Now you see the liver cirrhosis. Okay, liver cirrhosis means the end stage of any chronic liver disease. Okay, it is diffuse process characterized by the fibrosis and conversion of normal architecture to structurally abnormal regenerating nodules of the liver cell. Okay, so you can see these fibers. You can see the dense fibrous tissue. Okay, here you also, this is the zooming in the 100x, but this is probably 10x, so you cannot see properly, but these you can see that the fibrosis is here. Okay, also some better pictures is here. Okay, here you can see the you can see the fibrosis here the fibrous layer. Okay, dense fibrous tissue. This is the dense fibrous tissue, you can see. So what is the first point is the loss of architecture. Here is the architecture of the lung, or the normal microscopic architecture is also lost. Okay, so and the dense fibrous tissue is present, we see here also. What is the regenerating nodule? You can see that it is the nodule, it's a nodule. Okay, so these are the nodules, these are the regenerating nodules. You can see the micronodules as well as macronodules, and if the nodule size less than 0.3, when the nodule size is less than 0.3 centimeter, it is the micronodule, and when the greater than 0.3 centimeter, it is macronodule. So it is the liver cirrhosis. You can also see some fat cells. Okay, in the liver cirrhosis you can also see some fat cells. It is the vacuole, fatty vacuole. Okay, why it is vacuole forming? Because when we stain, the fat ducts are dissolved by the stain and rust out from the cell. Okay. Next we discuss the fatty liver. Here the fat vacuole in the cytoplasm is seen. Hepatocyte shows fat vacuoles. These there is lot of fat vacuoles, okay, in the cytoplasm. So and nucleus is pushed towards periphery by the vacuole. So you can see the nucleus here. Here you can see the nucleus. It's a cell, and you can see the nucleus are pushed towards periphery by the fats, okay. And in the fatty liver, normal architecture is maintained, okay. The normal architecture of liver is maintained. It is also the fatty liver, and here you can see it is the bile duct, okay. It is the artery, and it is the portal vein, and it is the fat cells, and here you can see the nucleus here. It is a microscopy of chronic cholecystitis. Here, what is the first point? It is chronic inflammatory cells in the mucosa is present. Here you cannot see properly in this microscopy, but here is the deep blue colored cells are present. These are the chronic inflammatory cells, and we can see the Rokitansky as of sinus. Here you cannot see properly. Here in the muscular layer you can see the Rokitansky as called sinus. Here it is, and you can see here also. These are the sinus, okay, RA sinus. It's all about the GIT and hepatobiliary system, important microscopy of the pathology.